A study by King's College London says that skin disorders can have a negative impact on the mental health of children and adolescents. The World Health Organization has said that monkeypox is not a global public health concern. The statement is in the response to World Health Network urging WHO to declare monkeypox a global pandemic. Research from the University of Texas Health Science Center People reports that people who received at least one influenza vaccine are less likely to develop Alzheimer's disease. Young Indian women with comorbidities were found to be at an increased death risk due to coronavirus than men, claims a new report by Sir Ganga Ram Hospital, Delhi. Hi, I'm Navya and you're watching OMH Capsule. Let's discuss today's headlines in detail. A new study by King's College London and Newcastle University has found that skin disorders can negatively impact the mental well-being of children and adolescents even if treatments are already available. A survey states that 98% of patients with a skin disorder report that their condition affects their mental well-being and only 18% received psychological support. The Medical Research Foundation has pledged £1 million to understand the mental impact of skin disorders better. The research will now investigate two skin disorders in particular, eczema and ichthyosis. Eczema is an inflammatory skin disease affecting 20% of children and 8% of adults. It is often linked to anxiety, depression, and ADHD. Ichthyosis usually affects the whole body. People affected by it often face harassment and discrimination, which can have an impact on mental health. On the 24th of June, the World Health Network declared the monkeypox outbreak a pandemic and urged WHO to declare it a public health emergency. But WHO does not seem to agree with WHN. In a recent statement, the WHO Emergency Committee said that some aspects of the monkeypox outbreak are unusual, but the committee does not consider the outbreak as a public health emergency of international concern. WHO also pointed to the emergency nature of the monkeypox outbreak and said that controlling its spread requires an intense response. The committee is closely monitoring the outbreak and will review it after a few weeks. The Public Health Emergency of International Concern Declaration is the highest level of global alert which currently applies only to the COVID-19 pandemic and polio. Indian women with comorbidities like chronic kidney disease, diabetes, hypertension are at a higher risk of death due to COVID than males. This study was conducted by researchers from Sir Ganga Ram Hospital, Delhi on more than 2,500 COVID-19 hospitalized patients from April 8 to October 4, 2020. The number of COVID-positive male patients was more than twice the number of females in this study, but females were found to be at a higher risk of death due to COVID. The findings showed that patients with chronic kidney disease were more likely to die of COVID, followed by high blood pressure and diabetes. A new study has found that those who received at least one influenza vaccine were 40% less likely than their non-vaccinated peers to be diagnosed with Alzheimer's disease. Researchers from the University of Texas Health Science Center compared the risk of Alzheimer's disease between patients with and without prior flu vaccination in a nationwide sample of US adults aged 65 and older. The study found that the strength of this protective effect increased with the number of years that a person received an annual flu vaccine. In other words, the rate of developing Alzheimer's was lowest among those who consistently received the flu vaccine every year. The research shows that the flu vaccine actually reduces the risk of Alzheimer's, but the underlying mechanisms behind this process require further study. That's it for today. Stay connected with the world of health by subscribing to OnlyMyHealth. And do not forget to like and comment on this video. Goodbye, stay healthy, and keep watching OMH Capsule for all the latest health updates.